Hello everybody, मैं हूँ डॉक्टर कुकरेजा ए कलानी. I am a practicing homeopath and today we'll be speaking about role of homeopathy in treatment of cancer. Homeopathy has been often used as an alternative method in treatment of cancer as we deal with the immunity of the patient, and it has a big role in retarding the growth of the cancer cells. So apart from that, we'll be speaking about the signs and symptoms, the different types, the investigations which are to be done, and the clinical judgment so as to diagnose the problem quickly so that we can start with the treatment as soon as possible. So let's know what is cancer. Cancer refers to one of the large number of diseases characterized by the development of abnormal cells that multiply or divide uncontrollably and have the ability to destroy the normal body tissue. It can infiltrate, meaning it can invade various organs at a very fast pace, and it has an ability to spread throughout your body. Cancer is the second leading cause of death in the world. Now, what are the general signs and symptoms you should be aware of so that it can help us diagnose cancer quickly? It is fatigue, lump or area of thickening under the skin, weight changes, unintended loss or gain of weight, changes in the bowel or the bladder habits, persistent cough, difficulty in swallowing, hoarseness. Then we have persistent indigestion or discomfort after eating, unexplained muscle or joint pain, and bleeding or bruising which cannot be explained. The most important thing is the investigations which are to be done so as to diagnose the problem quickly so the treatment can be started as early as possible. So the blood tests for cancer are the most important investigations which are done repeatedly so as to understand the pace of the illness. Apart from that, the important investigations include, which are very necessary, is the biopsy, that is taking a sample of the tissue and sending it for investigation. Later is the medical imaging, that is the X-ray, the CT scan or the MRI, and certain specialized tests such as the mammogram for breast cancer and a pap smear for the cervical cancer. So if we talk about the blood test, what are the important blood tests which are to be performed so as to understand the overall situation of the case? The first is the CBC, that is the complete blood count. Next is the tumor markers. Then is the blood protein testing, and the last is the circulating tumor cells. So first we'll talk about the CBC. So CBC is the complete blood count, which measures especially three types of blood cells which circulate in our bloodstream. That is the platelets, the red blood cells, and the white blood cells. So such tests are performed repeatedly so as to understand what are the normal values and what are the deranged values, so as to understand what is the pace and till what degree the cancer has spread, and to evaluate the current status of the patient. Next is the tumor markers. What are the tumor markers? These are the substances which are made by the cancerous cells on your body's normal cells in response to cancer. Some tumor markers indicate a specific type of cancer. So what are the important tumor markers which are done? So it is the AFP for liver cancer, that is the alpha fetoprotein. Next is the B2M, that is the beta-2 microglobulin, and the lactate dehydrogenase, that is the LDH for blood cancers, calcitonin for the thyroid cancer, CA125 for ovarian cancer, that is the cancer antigen 125. Then the cancer antigens 15, 3 and 27, 29 for breast cancer. Carcinoembryonic antigen, that is the CEA for colorectal cancer, lung cancer and pancreatic cancer. Then we have the HCG for the testicular cancer and ovarian cancer. And the last is the PSA, that is the prostate specific antigen for prostate cancer. Then what is the blood protein testing? So this is one important tool. The blood protein testing uses a special process called as electrophoresis to find out certain proteins in your blood. These proteins are the immunoglobulins, which your immune system releases in response to diseases such as myeloma. And the last is the circulating tumor cell test. This is a new type of blood test for cancer, which looks for the circulating tumor cells. So when the cells break off from the primary tumor focus and they enter your bloodstream, this indicates whether the cancer is spreading, whether the metastasis process is on. So this test is very important so as to understand the severity of the problem. So these are the blood tests and the other investigations which are very important to understand the pace of the illness. How do we tackle this? What are the things which should be taken care of? First and foremost is, in case you've had a genetic history of cancer, mother, father, siblings, or anybody in the family has had cancer, then you have to be very careful so as to avoid any trigger factors which will produce a conducive environment for the growth of the virus. Secondly, it is the stress. Stress is the number one killer. So if you've had long periods of, say, grief or depression or anxiety or certain things which you've been troubled for a long period of time, these definitely cause a lot of hormonal changes and makes your body more vulnerable. And a few things which you can always take care of, that is the environment. Always create an alkaline environment in your system. This can be done by consuming vegetables and fruits which have got high color, say green, red, blue, so that serves as an antioxidant diet. It neutralizes the free radicals in the system and keeps your environment alkaline and does not allow any invasion by any organisms. Then one very, very important thing is control over your diet. So we already mentioned not to have alcohol, caffeine, or refined sugar in large amounts, because this definitely provides a medium for the growth of the virus. And the most important thing is the oxygen levels in your system. So always remain well oxygenated. Exercises, pranayama, jogging, running, cycling, gymming, all sorts of physical activity would definitely help your lung capacity to increase your oxygen levels, so that all the organs in your body are well oxygenated, and so that the virus has no chance of thriving in such healthy atmosphere. So these are the few things that we need to remember so that we can avoid the cancer virus and its spread to any distant organs in our system. So let's speak about what is the role of homeopathy in treatment of cancer. How does it help in stopping the spread of this deadly disease? So homeopathy, being the widely practiced alternate system of medicine, employs small doses of various medicines to promote autoregulation and self-healing. It is the most commonly used alternative approaches in cancer and other diseases, and alternate therapeutic system. It is widely used as a palliative and as a supportive therapy in cancer patients, and also overcoming the side effects of chemo and radiotherapy. Many cancer patients use homeopathic approaches to increase their body's ability to fight cancer, improve their physical and emotional well-being, and most important, alleviate their pain resulting from the chronic disease, as well as the conventional treatment. The conventional treatment offers a surgery, radio, and chemotherapy, as all these are important to stop the spread of the disease, but because of the same, the immense side effects caused can be dealt with the homeopathic medicines. Finally, the aim of all the treatment is to put a stop to the progress of this virus. So the main aim of treatment is to boost targeted disease-specific immune response and retard the cancer growth. Clinical studies of homeopathic remedies combined with the conventional care have shown that homeopathic remedies improve quality of life, reduce symptom burden, and adds healthy years to the life of the cancer patient. That is, improves survival in patients with cancer. Homeopathy has beneficial effect in cancer care. Apart from this, the low-cost treatment, minimal risks, and the potential magnitude of homeopathy effects are considered in certain situations as an additional tool to integrate into cancer care. Thank you, dear listeners. Hope this information serves the purpose of early detection of the disease via the symptoms and guides you through choosing the correct, appropriate therapeutics or medicines to help limit this disease so as to bring about the best outcome and prognosis.